What we want healthcare to be is we want healthcare to become proactive. We don't want healthcare to be an episodic view into your life when you feel sick and when you feel the need to come to see us. We want healthcare to be proactive. We want it to be a continuous part of your life, a continuous part of what a person's going through. And wherever we feel that there is need for intervention, healthcare is going to interact with you and make sure that we have that interaction. What we're trying to do with technology is we're trying to help providers play to the top of their license. That's the official terminology, which means today a primary care physician is no more than a glorified triage person, right? They're looking at your melanoma, sending you to a dermatologist. They're looking at your diabetes, sending you to an endocrinologist. But they're all trained to manage all those things themselves. So what we're hoping to do is, with the power of technology and data, we're helping people, nurses, MAs, physicians, specialists, primary care, practice at the top of their license so that they are doing everything that they're trained to do.
There could be remote, you could be remote from healthcare because there's geographical barriers, there's economic barriers, or perhaps there just isn't enough healthcare providers in any community that's close to you. So Project Echo is to bridge those gaps, to address those barriers in healthcare for underserved populations. And it doesn't necessarily have to be rural. It could be someone in an urban area who doesn't have access to healthcare. Echo is not new technology and it's not high technology. It's a new model for healthcare connectivity to develop these learning networks and to allow primary care folks to provide the care to the patients where they're at. Over time, Echo is going global, and the goal is 1 billion lives by 2025.
The next wave is coming at us right now, and it's how do we interconnect the systems that we spent 30 years developing.
We have to move from providing discrete products to really providing now solutions and services, and that's what we're moving to as a company. And we think to be able to do that, we need to focus on the entire disease cycle. So not just diagnostic imaging or not just therapy, but everything from prevention and lifestyle to screening and diagnosis, treatment and therapy, and all the way to chronic health care.